Erectile dysfunction, or ED, is a common concern for many men, but it's important to know that it is often treatable. This video offers practical, non-medical tips for improvement. This video will explore 5 practical, non-medical tips to help you regain confidence in the bedroom. These strategies focus on holistic well-being and natural improvements. Understanding ED begins with recognizing its underlying factors, primarily blood flow, hormonal balance, and daily lifestyle choices. Addressing these can lead to significant improvements. Healthy blood circulation is crucial for erectile function, as it directly impacts the ability to achieve and maintain an erection. Optimal flow is key for consistent firmness. Hormonal balance, particularly testosterone levels, also plays a significant role in sexual health and desire. Maintaining these levels is vital for male vitality and overall well-being. Finally, daily habits like diet, exercise, and stress management profoundly influence your overall well-being and erectile function. These lifestyle factors are often overlooked. Our first tip is to improve blood flow, which is fundamental for strong erections. Enhanced circulation is a cornerstone of healthy erectile function and overall health. Engage in regular cardiovascular exercise, such as brisk walking, jogging, or swimming, for at least 30 minutes most days of the week. This strengthens your heart and vessels. Incorporate foods rich in nitrates, like leafy greens and beets, and omega-3 fatty acids found in fish, to support vascular health. These nutrients promote healthy blood vessels. Crucially, reduce or eliminate habits like smoking and excessive alcohol consumption, which severely impair blood circulation. These choices significantly hinder erectile health. Our second tip focuses on lowering stress, a major contributor to ED. Chronic stress can negatively impact both physical and psychological aspects of sexual function. Practice deep breathing exercises or meditation daily to calm your nervous system and reduce anxiety. These techniques can significantly improve your mental and physical state. Open communication with your partner about your feelings and concerns can also significantly alleviate stress and strengthen your bond. Sharing can reduce pressure and build intimacy. Tip number 3 involves strengthening your pelvic floor muscles. These often overlooked muscles play a vital role in supporting erectile function and urinary control. Kegel exercises, often associated with women, are highly beneficial for men too, as they improve blood flow and muscle control in the pelvic region. They can enhance firmness and stamina. To perform a Kegel, simply contract the muscles you use to stop urination or prevent passing gas. It's a subtle contraction, focusing on the internal muscles. Hold the contraction for a few seconds, then release. Repeat this 10 to 15 times, 3 times a day, to build strength and endurance in these important muscles. Our fourth tip highlights the critical link between sleep and hormones. Adequate, restorative sleep is essential for maintaining optimal hormonal balance in men. Adequate sleep is essential for testosterone production, a hormone vital for male sexual function. Insufficient sleep can lead to a significant drop in testosterone levels. Aim for 7 to 9 hours of quality sleep per night to optimize your hormonal balance and overall health. Prioritizing sleep is a powerful tool for well-being. Establishing a consistent sleep schedule and creating a relaxing bedtime routine can significantly improve your sleep quality. This consistency helps regulate your body's natural rhythms. Finally, tip number 5 addresses emotional confidence. Building self-assurance and reducing performance anxiety are key to a fulfilling sexual life. Reduce the pressure to perform by shifting your focus from intercourse to intimacy and connection with your partner. This reframe can alleviate anxiety and enhance enjoyment. Explore other forms of physical affection and communication to rebuild confidence and reduce anxiety surrounding sexual activity. Intimacy extends beyond just penetration. Remember, intimacy is about shared experiences and emotional closeness, not just physical acts. Nurturing this bond can significantly improve your sexual satisfaction and confidence. While these tips offer valuable non-medical guidance, it's crucial to know when to seek professional medical advice. Self-care is important, but professional help is sometimes necessary. If ED persists despite lifestyle changes, or if you have underlying health conditions, consult a doctor for a proper diagnosis and personalized treatment plan. They can rule out serious issues. To summarize, our 5 tips for regaining confidence are: improve blood flow, lower stress, strengthen your pelvic floor, prioritize sleep and hormones, and build emotional confidence. These are actionable steps. By incorporating these strategies into your life, you can take significant steps towards improving your erectile function and overall well-being. Consistency is key to seeing results. Remember, you are not alone, and there are effective ways to address ED and regain your confidence. Taking these steps can lead to a healthier, more fulfilling life.